Hello, everyone. Welcome. I'm Teresa. I think we're just starting to go live, so it'll take us a few minutes to get everyone on. Hello, everyone. I'm Teresa. We're just waiting to get everyone here. And if you're on already, we'd love you to say hi in the chat room. Maybe you could let us know where you're joining from. Oh, Maria from Atlanta. Oh, we're so glad to have everyone here. I'm Teresa, and as everyone's joining, maybe you could say hi in the chat. Sherry from Alabama, Jamie from New York, Eloise. Hi, Don and Siobhan from a little north of LA. Yep, Minnesota, Tucson. Oh, Connecticut. Joan from Wisconsin. Oh my goodness. We're so thrilled that everyone's here. And we'll just give this a couple minutes to make sure we give everyone enough time. Hi, Elaine. Jim from Fort Myers. Paul from Canton. Hi, Chris from Ohio. Everyone, if you're just joining, I'm Teresa. We are waiting a few minutes to get everyone a chance to come on. If you'd like to join us in the chat, say hello, maybe tell us where you're from. Hi, Doug from New Hampshire. Oh, Richard. Steve from Sarasota. Hi, Barry. Mark from Lake Balboa. We're so pleased to have everyone here together. Hi, Ed. Wonderful. Our friends from Boston. Roberta from St. Louis. Welcome again, everyone. I'm Teresa. Hi, John. John from Cambridge. We're just having everyone say hello in the chat if you're just joining us, and maybe have a chance to say where you're writing in from. Hi, Deb from Seattle. Dave, Judy. Judy from Glastonbury. Hi, Tom. Maggie. Ed from Newport Beach. Hi, Bob. Anne. Hi, Anne. Suzanne from Claremont, California. I think we'll give it about another minute. I want to welcome everyone that's already here. And people who are just coming on, maybe you want to say hello in the chat. I'm curious where everyone's from, how everyone's doing. And I think we're live on Facebook now as well. Welcome, everyone from Facebook. Oh, great, Falls Church, Virginia, Virginia Beach. Richard from Lincoln. Wow, Chris from Oakville, Ontario. Welcome. Alicia, Grand Rapids. We're so happy to have everyone with us today. We'll just give this maybe one more minute. Oh, that's super. Well, I think we'll get started. Again, we're so pleased to have everyone here with us today. My name is Teresa, and I am one of the physical therapists from Boston University. This is part 2 of a 3-part series related to balance for people with Parkinson's disease. And today, we're going to discuss assessing balance with a physical therapist for people who have Parkinson's disease and what goes into that and why that's important. So again, I'm one of the physical therapists from Boston University. We are part of the Center for Neuro Rehabilitation. We are on the campus of Boston University, but through the support of APDA, we're here for everyone across the country. This is our contact information. If you had a chance to get in touch with us on social media, we would certainly love that. So again, welcome everyone. We're glad you're here. So why is it important to assess balance for people who have Parkinson's disease? Well, for one critical reason is that one of the major motor or movement symptoms people with Parkinson's experience is postural instability. We would use this as another way of saying imbalance or difficulty with balance. The other major movement symptoms, bradykinesia or slowness of movement, rigidity or stiffness of movement, and tremor, of the four of them, three of them can contribute to balance problems. So balance is a critical issue for people who have Parkinson's disease. Another thing I'd just like to note is of the four major movement symptoms, three of them are a little more responsive to medication than postural instability is. So it's even more important to have an excellent understanding if people are having difficulty with their balance of why that is. Another critical component related to balance with people who have Parkinson's disease is people with decreased balance are more likely to fall. Estimates indicate that up to 68% of people with Parkinson's disease report at least one fall per year, and that is a higher rate than equivalent older adults. So we know people with Parkinson's disease have a tendency to have more balance issues and have a tendency to fall more. We also know falls are a major contributor to disability, to injury, and to decreased quality of life. So it is critical to identify people who are at risk of falling. In our clinic, we use a quick 3-question measure to get a very general idea of the probability that someone might fall. So we ask everyone, or we measure these 3 things with everyone. We ask them, have you had a fall in the past year? Have you experienced freezing of gait symptoms in the past month? And then we do a very quick walking speed measure. So we want to know, given 4 meters, which is about 13 feet, can someone walk that in about under 3.5 seconds, or does it take them longer than 3.5 seconds? Based on the answers to these 3 questions, we have some idea of prediction of who would be likely to fall within the next 6 months. And we stratify that in a low, medium, and high probability. So we want to identify with everyone who may be at risk of falling. And balance assessment is one way to do that. What goes into keeping your balance? We know balance is not just one thing, it's complex. And Tim from our office at Boston University gave a great presentation on this in July, just in explaining the different aspects of balance. That presentation is available on the APDA website for everyone to view. So if you haven't had a chance to see it, I'd love to encourage you on that. So when physical therapists talk about balance, we often break them down into these 6 different components. And this is based off a lot of study and a number of research articles. For today's session, what I'd like to do is use these particular terms. And these are a little bit more of how we think of what is being assessed of all these different categories. So you'll see this kind of information graphic come up throughout the different slides today. And I like to go through what we mean by these different aspects when we're testing. What is the ultimate purpose of a balance assessment? Well, it's really detective work, and that's how we feel when we're assessing someone's balance. Considering the different components of balance, we are trying to investigate for a particular person, what is the pattern of difficulty? Is there a particular profile? Of these certain areas, does one tend to stand out? Is there a pattern, for example, say someone is always losing their balance in the kitchen, or is it if they're walking outside and the surface is not steady, or is it happening when they're getting distracted? So we are questioning all elements of balance and trying to put together for a particular person, what could be the reasons for a balance issue? And then we're trying to put that information together to formulate an individualized, specific, challenging balance training program. So today, we're really talking about the detective work piece of assessing balance. For balance assessment, what does a physical therapist examine? Well, for one part of it would be a lot of listening, questions, discussion. We want to gather as much information as we can, and recognizing that balance is a very individualized, it can be very individualized. So what's a problem for one person is not clearly going to be a problem for everyone. So one thing we're curious about is someone's history of past falls or near falls or close calls in the house. Very curious under those circumstances, what happened, what were the environmental conditions. So we're really curious about any sort of past history of losing balance or falls. We're also extremely interested to listen and try to understand, how does balance present a concern for an individual in the course of their daily life? How does it affect their movement around the house? How does it affect their movement outside of the house? What does the family notice? Just for example, I have some people that I'm working with who might say they don't have a problem with balance, but when we ask further questions, they'll say things like, I don't do that anymore because I wouldn't be safe. Or I have someone that doesn't do the vacuuming anymore because it's not going to be safe to manage the equipment, the cord, the way the rug is. Or someone that's not walking outside by themselves anymore because they're not sure they can be safe. So we are very curious in terms of how balance is impacting someone's daily life. We have specific questionnaires that we often give people related to their self-confidence with balance. So we might give a very standardized questionnaire asking questions about self-confidence under different conditions, and that gives us a very objective measure, something that turns into a number that we could perhaps track over time. We're also interested in other aspects of people's health and what's going on with them. For example, we're curious about someone's sleep pattern, curious about high blood pressure, might ask questions about cognition, depression, many other things that go into someone's mood and ability with balance, and also affecting their daily life. So the beginning of an assessment is a lot of questions and trying to understand individual information and individual situation. When it comes to balance assessment, there will also be a physical balance examination. So kind of taking these, say, 6 components of balance. Maybe we start off perhaps with the strength and flexibility assessment. So a physical therapist is looking at the flexibility in different joints of the body, ankles, hips, neck, shoulder. We want to know what's tight, what's stiff, is something painful. I'm also very curious about the strength of different muscle groups. So we may be doing just a number of different strength or flexibility tests that give us information that will help us put the whole puzzle together. When it comes to standing stability or posture assessment, I'm going to borrow a picture that Tim showed in our presentation, his presentation last month. This is a picture from one of the first documented cases of someone with Parkinson's disease. And I just want to point out a little bit of the forward, sort of forward-leaning posture. These red lines near the feet indicate the support base that the feet kind of form. So the area that around the feet are going to be the support base for the body. The yellow line indicates the center of the body and the way gravity pulls on the center of the body. So the way someone is aligned with their posture gives us a lot of information about where their center of their body is going to be relative to their support base. So we're always looking at someone's posture and looking at their posture in terms of how they initially seem or present themselves. And we're also curious, could someone change their posture? If they were particularly trying to stand up tall, could they do that? Is it modifiable? Are they in a particular posture, again, because something's tight or something's stiff or something's painful? These are all pieces of information that will ultimately go into our balance training program. But we want to pay particular attention to someone's postural presentation. When it comes to balance reactions, we have a number of different categories, but these first 2 I'll try to highlight. We have tasks that we So this is someone's expected balance reaction. Tasks that we do in regular life that take a balance reaction, but that we know is coming. We know if we're going to reach something into the cabinet, what that feels like. And the body anticipates what is needed and makes subtle adjustments. The muscles, the joints adjust to be able to have the balance we need for the task that we expect. So this is balance related to something that we expect is going to happen. And this kind of thing happens all day long. Anything related to lifting, carrying, pulling, chores around the house, chores in the yard, even just getting dressed, taking a shower, all those kind of tasks have this kind of expected balance reaction that we're doing all day long. In the clinic, we want to assess this as well. So we may ask someone to say, stand up from a chair without using their hands, or perhaps come up on their toes. Maybe do that first while they're holding on so they know what to expect, and then ask them not to hold on, and then have them come up on their toes again. And all the while we're kind of watching what their body is doing, how it's reacting. We may ask someone to stand on one leg and see how that kind of adjustment or what reaction they're able to achieve for a balanced challenge that they expect. So this is definitely a component of the balance assessment. Another aspect of balance that we want to assess is this idea of an unexpected balance reaction. And by that, what we mean is situations or tasks that happen where you don't expect what's coming, but your balance, your body has to react to it in order to keep your balance. So I think on the presentation last month, Tim gave a nice example. If you imagine you're on the bus and the bus driver starts off gently, and it's true, you may have a little bit of an idea of what's happening, but you don't know exactly when the bus is going to take off, and you make a reaction. If the bus driver has to slam on his brakes, you have to make a bigger reaction to hold your balance. In real life, this happens a lot as well. Can you imagine being with children or walking the dog and the dog sees a squirrel, or even just being in a busy environment where someone's bumping you or brushing by you, and it's something you don't necessarily expect, but you have to react to in order to be safe. And these balance reactions have to be fast enough and strong enough to help you keep your balance. In the clinic, we have a series of tests that we do where what we ask people to do is lean into a physical therapist. So in this one picture, you see the taller woman is leaning forward into the other therapist who's giving her support. And then what we do is unexpectedly let go. And we see how people react and are they able to take a step, catch their balance. A similar version of this is very commonly done in the neurologist's office. So you may have experienced the test the neurologist does where they stand behind and give kind of a pull, and they're trying to, again, examine your reaction when you don't expect what's coming. When it comes to the sensory systems, for these, what we mean is vision, the inner ear sense of balance, which tells the brain where the head is in space, and then touch sensation. So a lot of that is what you feel at your feet, particularly what your joints feel. Those joints and the touch of the feet also send information to the brain about what's going on and where the body is. So we might particularly assess someone's sensation in their feet as part of the earlier physical exam to get an understanding if that's impaired or not. And in real life, this pops up quite a bit. Anytime you're walking on an unsteady surface, like say the beach or grass or leaves, your body is having to adjust to the surface that's not steady. And the information is constantly being transmitted from what your joints sense to the brain and back down from the brain to make adjustments to keep you balanced. Can also imagine situations where, say you don't have your full vision. Say, for example, you're up in the middle of the night and it's dark, but you have to get to the bathroom, your vision hasn't adjusted. So situations where you don't have your full vision available to you can also be difficult for balance. So that's actually something we want to assess in the clinic. Again, this is relevant in real life situations where things are unsteady, maybe things are uphill, that kind of thing. So in the clinic, what's typical for us is to evaluate someone's balance when they're on a steady surface, and then also when they're on a foam surface, when their feet are very narrow. We also, again, as I mentioned, we investigate how people's balance responds when their eyes are open, how it responds when their eyes are closed. When it comes to stability with walking, this is another area that we want to pretty stringently investigate to find out what elements of walking stability may be problematic for a certain person. And this, again, happens in real life all the time. If someone's walking and talking to you, you're turning your head to look at them, maybe distracted by what you're seeing. If you're walking, you have to check your phone, or you're checking something in the distance. Even at home, just walking while you're trying to talk to someone else or think of something. So this idea of stability with walking is something we test as well in the clinic. And we test this with asking people to walk faster, walk slower, walk while they're actively turning their head. We ask them to walk and do a quick turn and stop. We ask them to walk and step over an obstacle. We'd ask them to walk and make a quick turn, and then ask them to maybe do some walking while they're doing counting tasks in their head, something that's purposely designed to distract someone, to see how do those challenges affect someone's stability with walking. We know that for people with Parkinson's disease, the automatic nature of walking can be affected. So often people are using a lot of concentration to maintain their walking, maintain their steps, maintain their balance. So when something disrupts that concentration, it can be a problematic challenge for balance. So we really want to understand for a particular person, what are the challenges, and then try to determine why, so we can determine what to do about it. So in brief summary, balance is complex, certainly not just one thing, and we want to look at all aspects of balance with the assessment. A balance assessment is critical for people who have Parkinson's disease in order to develop a personalized balance training program that will address some of these issues and keep people safe. We also advocate frequent assessment of balance. So we try to do it with someone every 6 months, every year, every time we see them, similar to how you'll see your neurologist periodically. We believe people should be checking with a physical therapist periodically, and balance assessment should be part of that check-in. Another important component here is a balance assessment can identify people who might be at risk for falling. And maybe one of the biggest takeaways I want to indicate today is you don't need to wait until you have a balance problem or wait until you've had a fall to have a balance assessment. In fact, we strongly prefer to assess everyone early on in their diagnosis and their course of care, because it gives us an understanding of perhaps small issues that could be addressed. We can be proactive in helping to treat balance. So we strongly believe everyone should be assessed by a physical therapist for their balance. There is a lot we can do to help people with balance and to treat different issues and recommendations we can make, but the assessment is the critical first piece. So we do want to let you know that part 3 of this series is coming up in September, where we're going to talk about treatment ideas for balance. So we definitely hope to see you for all of that. And our physical therapist, Tammy DeAngelis, is going to give that presentation in September. And actually, we're going to welcome her in just a minute to try to manage the questions from anything that came up in this talk today. The other thing I want to mention, again, we're at Boston University, but with support of APDA, we are here for everyone. We have a toll-free helpline, and we'd love to take questions related to exercise, related to issues that we could help with. Our email address is rehab@bu.edu. So we're really here to help anyone, especially related to exercise, as much as we can. So with that, I just want to say thank you to everyone, and then just curious if we could take some questions in the chat and maybe even discuss a little further anything related to assessment of balance.
That's great. Thank you so much, Teresa. That was really great. We do have a whole bunch of great questions in the chat. And so I'm going to start with the first one that came up in the Q&A from Paul, who would like to know if you have anything to comment on. His balance issues occur with no schedule, which is definitely something I hear from patients I work with. And he finds when he's sitting for too long or he's inactive, once he gets up, he kind of feels frozen and the legs don't want to move. Do you have any suggestions for helping with that?
I mean, I agree. I hear that question or a comment from a lot of people as well. And Paul, I want to thank you for that question. Of course, there's no perfect answers, but if I could even maybe give some suggestions, the idea that if someone's been sitting for a while, the stiffness, it could be a little more prominent. So I have some people who have a small sitting stretching routine. And if they think of it before they have to get up, they're able to try that a little bit first thing upon sitting. I have someone that does a little bit of a Tai Chi style program. He does a little bit of his Tai Chi movement when he first stands. Now that doesn't always work if someone is trying to rush to the bathroom, but the idea of being aware that first standing after sitting for a while is going to be a little more difficult. Some recommendations are perhaps trying to stay in place, maybe with a hand on something for support to make sure any blood pressure issues perhaps settle. In standing, maybe a small amount of movement gently before someone's able to walk or take off. But I do understand the question. It's frustrating if there doesn't seem to be a pattern because that's something that it doesn't get a very obvious solution. The other thing I'll say, and this is a very global comment, is that we know a balanced training portion of someone's weekly exercise routine is so critical. So if that's not already something that's being incorporated, I would suggest that as well.
Okay, great, thank you. Our next question, and this also comes up a lot, and it's sort of, I have more than one question regarding this, but the general question is about footwear. Do you advise or recommend any particular footwear for people with balance? And Nina had asked specifically about insoles, like Noboso insoles. That's one part of the question. And the other part of the question that we get a lot is people with neuropathy, which does impact balance as well outside of Parkinson's. So do you have any suggestions for that also?
Yes, I understand this question does come up quite a bit. I don't have one perfect answer. I do have to say that. So I would say comfortable, well-fitting footwear that is secure on the foot. So that would be my first very general recommendation. So the idea of a flip-flop or a slide-in slipper or sandal, the foot is working hard to keep that shoe on the foot. So it's just another area of complexity that we don't necessarily need. So I'd recommend footwear that either ties or that's secure and that has a heel support. I would also recommend, sometimes I've seen footwear marketed for balance training, but by itself, that style footwear is higher and sometimes cushier. So sometimes that provides an element of instability. So I just want to be sure that someone's not dealing with, say, a rocker style shoe or an insole that's very soft that someone feels like they're sinking into. When it comes to neuropathy, again, perhaps a little different for everyone, but generally indicating that the sensation is not as clear from what the feet feel to the brain. So in that situation, they recommend people are not barefoot, that they have, again, a well-fitting shoe that would protect their foot from, say, stepping on something they don't feel.
Great, thank you. Here's another, we have a lot of great questions in here. There's something from Alice. What would you advise people do to improve their balance?
Alice, what a great question. And there are so many things, and I don't want to steal the show from the presentation we have in September. However, if I could just say, we have so much information that challenging balance in an appropriate way. So sometimes we'll use the word the just right challenge, and that's going to be different for everyone. What that means is activities or movements where you are actively working your balance. So just one example, say a movement style, maybe similar to Tai Chi, where there's a shifting of weight from different parts of the body back and forth. It's training the brain, it's training the muscles, training the joints, how to accept a weight shift. And there's great evidence that can help people with balance. We know there's a lot of evidence that dance-related movements or dancing in general can have positive effects on balance. And the idea that you have or anyone has a balanced exercise program, so something that they're actively getting to 2 or 3 times a week, we think is a critical piece of a complete exercise program. I know that's a very generalized answer, Alice, but I would say the first step is a balance assessment so that there could be specific recommendations made for you.
Great, and we hope you'll all join us next month when I talk about treatment, and we'll get more into that. So here's a really good question, and you're presenting to us what a physical therapist would do to assess people's balance. And we've got a bunch of questions. Neil and Janet have both brought up, how do you, if this is a specialized thing that a physical therapist would do, how do you find a physical therapist who's either trained in this or has experience in Parkinson's? Especially if you live in an area where there are less resources like that. What would you recommend?
Yes, I understand. And this is the kind of question that if it was a very particular area, we'd love to help via our exercise helpline. So if this doesn't get at the answer for whoever asked the question, could I strongly suggest you email us or call us? But very briefly, I do want to say physical therapists have certain specialties or can have certain specialties. Some physical therapists specialize in treating older adults. Some specialize in treating people who have neurological based conditions. So if there's a possibility that there's a physical therapist in your area with a neurologic or a geriatric specialty, those would be my first suggestion. My other suggestion would be in your area, there may be hospital-based groups or other physical therapy offices that indicate that they're familiar with treating people who have Parkinson's disease. Those physical therapists should be well versed in a balance assessment. If none of that seems relevant to your area, could I suggest you contact us on our exercise helpline because we're happy to try to help find resources in a particular area.
Awesome, thank you. I'm trying to find similar questions. We have both Chris and Thomas are asking about frequent falling. So they're falling, several times a day sometimes. Do you have any, and one of them has a component of freezing of gait is contributing to those falls. Do you have any advice for people falling several times per day?
Tammy, I do. I understand this is a generalized answer, but I hope it could be helpful. Sometimes there is a tendency to be able to find a pattern with those falls. It's possible if this is something happening in the house, it can be typical for a more freezing episode to happen in a very narrow environment, such as a doorway or you're just turning to get to the bathroom. We have used different strategies to try to address that. Some of that, first of all, if someone's freezing, is to try to stop the freeze and not keep trying to progress through it. So we'll often train people as best we can to try to stop immediately. And then different style strategies, different style movements, or visual cues. Sometimes we have people imagine stepping over something. We've even put tape marked lines down on floors of people's homes so that they have something visual that gives them a cue of how to keep their steps even and regular. We've also had people try to use the idea of music or something like a beat or even singing to themselves, something that provides kind of a timing to help the stepping instead of very short, small steps that are ineffective. This is also something that would be very well addressed by a physical therapist who could provide an evaluation, because I understand that the idea of, for several people, freezing incorporates falling multiple times a day, and it's scary, and it's something we want to address.
Great, thank you. So we're low on time. For those of you there's some great questions still in our Q&A. If we didn't get to them live, you can absolutely contact us at the number on your screen, 888-606-1688, or email us and you can speak with us and we can talk to you about your question. There's some questions about posture and use of walking sticks. So those are really great questions. And then just a couple of reminders, in August, September, October, we do have virtual, APDA has a bunch of virtual walks still happening. So those are a great way to get involved and get out there and walk. And lastly, if you are enjoying these webinar sessions and others that the APDA is supporting, we encourage you to consider a donation today so that we can keep bringing you this content. So thank you so much, Teresa. And thank you to all who joined us today. And we hope you'll join us next month.
Thank you so much.
All right, take care.